For the first 6 years of his medical career, Dr. Neil Creighton was an emergency physician. He became fascinated with the vast number of orthopedic emergencies that he saw. His background in basketball and other athletics made him a likely candidate for this emerging area of specialty. Dr. Creighton traveled to British Columbia to get a master's degree in human kinetics and a sports medicine fellowship, and returned to Manitoba in the early 1990s. Back then, sports medicine as a specialty would have been in its infancy.
It really was. It was really only in some major centers throughout Canada. And since then, basically every medical school now has kind of specific sport medicine training.
In addition to his work at Legacy Sports Centre, Dr. Creighton consults with a number of professional teams, including the Winnipeg Blue Bombers and the Canadian National Women's Volleyball Team, and is a highly regarded speaker.
It brings a different type of demand, the demands of working in a team context with management, with coaches, with trainers, with professional athletes, and that puts a special demand on the skills that we have. It's interesting being part of a team. It makes sense in sport medicine that you like to be part of a team, but that often complicates matters. Being on the sidelines at a football game is one of the best tests of your skills. You have to think quickly, you have to make important decisions quickly, and again, you're doing it with lots of people around. So I find it a good test of our skills, especially the work with the Blue Bombers.
Have you seen a change amongst parents of kids in sport? Is there more intensity?
Parents seem very invested in their kids' sports these days, and not only driving them to the sports before and after school, but in terms of helping their child become, in some cases, super athletes. And that's one of the things we're very aware of in the clinic, helping the parents to kind of dial back sometimes unrealistic expectations for their child. We in sport medicine need not to be seen as just getting people back on the field or on the soccer pitch at the expense of everything else. We're really more concerned with health than we are with performance. We know there's an obesity epidemic, and for kids to be exercising is fabulous. But for kids to be getting hurt in sport and developing lifelong problems at the age of 15 is really not acceptable. And so kind of working in that context, helping the parents to be rewarded for having their kids exercise, but kind of taking their foot off the accelerator sometimes so the kids can have enjoyable sport without the risk of injury.
The sports medicine approach not only helps a range of people from amateur to elite and professional athlete, much of the training and specific understanding of kinesiology and body biomechanics helps with the treatment of arthritis and age-related hip and joint impairment.
We use our knowledge of kind of biomechanics and how the system works together from kinesiology training to help people overcome impairments to their function. So the demand for that is huge. We have a tsunami of arthritis and people requiring hip and joint replacements coming on our culture as people age. The obesity epidemic is causing a lot of arthritic problems from a degenerative perspective. And then people who are crazy into sports are really carving up their knees and their hips from running marathons and playing soccer, sports like that. So in terms of the way the knees are performing for you, are they swelling much right now?
They're not really showing a lot of swelling, but it feels like a lot of swelling like deep inside. When they cool off after practice, it's like I can't walk.
So you just feel that the performance on the court is declining, the pain is constant. So there's a tremendous segue really from what's considered sport medicine knowledge. I have a saying, from babas to beefcakes. So we look after people who have impairments no matter how old they are, and the principles of trying to strengthen yourself apply to everybody.
Dr. Creighton's work involves developing a plan to strengthen vulnerable parts of the body.
We know that people who have back pain are more vulnerable to that back pain if they have weak back extensor muscles. We know that people who have knee problems and hip problems are more vulnerable if they have weak hip abductor muscles. So specific strengthening for those things is like brushing teeth. Everybody should be doing it. And those types of training can decrease impairment for many conditions.
And is that an aspect of what you do here?
Every case. I would say virtually nobody leaves here without a specific exercise prescription. We very rarely write medical prescriptions. We almost always write specific exercise prescriptions. We have a complicated computer-based program that helps us kind of custom make exercise prescriptions for really all of our patients.